This training video has been produced by the Vale of York CCG to support staff working in care homes with hand washing technique, the use of personal protective equipment and how to test residents for COVID-19 using the swab test that we will provide. It is really important to make you sure that you are aware of the infection prevention and control principles in order to protect yourself, colleagues and your residents from infection and spread of COVID-19. Long hair should be tied up, off the collar and away from the face. Uniform should be bare below the elbow. There should be no jewellery or watches, and particularly no rings with stones other than a plain wedding band or small stud earrings. No lanyards should be worn, and there should be no false nails or nail varnish, as these harbour bacteria. Nails should be kept short and clean, and fresh uniforms should be worn at the start of each shift. It is important that you are well prepared. Visit the toilet, ensure that you're well hydrated, as it can get really hot and uncomfortable when you're dressed in PPE. Hand hygiene is crucial in the prevention of spreading infection. Hands can be washed with soap and water or alcohol gel using the same technique. Visibly soiled hands should be washed in soap and water, and make sure to dry your hands properly because they can become very sore if not. Izzy will now demonstrate hand washing technique using the gel. So first and foremost, get a big dollop of gel on your hands. And you're going to rub the hands palm to palm. Probably 5 rubs each way. Then we're going to put the right palm over the back of the other hand and interlace the fingers. And then vice versa. Next, palm to palm with the fingers interlaced. And then back of fingers to opposing palms with fingers interlocked. Next, rotational rubbing of the left thumb clasped in the right palm and vice versa. Then, rotational rubbing backwards and forwards with clasped fingers of the right hand into the left hand. Incy wincy spider. Finish off with the wrists and up the forearms. You are now ready to don or to put on your personal protective equipment. For this, the equipment that you will need will be an apron, a fluid resistant mask, goggles and gloves. Make sure that the gloves that you choose are not too big because they'll be baggy and not protect your hands, or not too small because they might restrict your movement or snap. This training is for personal protective equipment in relation to the sustained transmission of COVID-19. If you are in an environment where aerosol generating procedures are being carried out, this requires different sets of equipment, so please contact your manager for advice. You should always don your personal protective equipment before entering the resident's room. So first and foremost, as demonstrated, perform hand hygiene. Then take the apron and place it, without wafting it about, place it gently over your head. Open it fully to ensure as much coverage as possible over your uniform, and tie the waist ties behind the back. If you find that the apron doesn't cover the front of your uniform and is a bit baggy around the neck, then you can pop another tie in the neck just to shorten it up a bit. Next, you need to don your face mask. These come in different types. These are fluid resistant surgical masks, and you will find the outer is usually coloured blue to indicate the fluid resistance. At the top of the mask you will find a metal strip which is used to mould across your nose to ensure a snug fit. The mask that Izzy is using is elasticated. For some people, the straps might be a little bit baggy, and again, you can always pop a knot in them. Other masks, which I've got ties, you would first of all tie around the neck and then bring it up and tie on the crown of the head before moulding it to your face. For this mask, Izzy is going to place it over her face and attach each of the straps behind her ears. She'll press firmly along the nose piece and ensure that the mask is pulled right down under her chin. Next is donning the goggles or the face visor. Some of these are single use. The goggles we are using are reusable and can be cleaned after use. If a visor has foam or elastic, then they should be discarded after their use. Place the goggles over the face and eyes and adjust to fit. Next, we need to don the gloves. As mentioned previously, ensure that you've got the correct size. Grasp outside of the glove and pop them on. You are now ready to enter the resident's room. Before taking the resident's swab, ensure that they have given their full informed consent. For those without capacity, you will need to consider the guidance provided relating to best interest decision. Ask the resident to blow their nose. The procedure can be uncomfortable, and therefore it's a good idea to provide tissues and a glass of water for afterwards. Ask the resident to tilt their head backwards slightly. Support them if necessary. Gently swab the back of the throat at each side of the tonsils. Avoiding the tongue and the soft palate. Then gently insert the swab into a nostril until there is slight resistance and rotate 5 times. Remove carefully and repeat in the other nostril. Place the swab into the collection tube, snap where it's indicated, and then place in the transport tube held by the buddy. Instructions for returning the swab will accompany the packaging. Once finished with the resident, you will be ready to remove or to doff your personal protective equipment. Before leaving the resident's room and ensuring that you're stood 2 metres away, preferably in an ensuite if it's available for the hand washing facilities, start by removing your gloves. These are the dirtiest and so are always removed first. Grasp outside of the glove with the opposite gloved hand and peel it off. Hold the removed glove in the gloved hand. Slide 2 fingers of the ungloved hand under the remaining glove at the wrist. Peel the glove over the first glove, discard into the bin and then gel your hands. Next, remove the apron. Break the neckties and lower down, taking care not to touch the front of the apron where the bacteria and viruses may be. Next, break waist straps from behind the back. Peel the apron forward but only touching the inside of the apron. Fold or roll it into a bundle and discard into the bin. Now, gel your hands. If you have disposable eye protection and you are finishing your session, you can now discard of your eye protection. The goggles that Izzy is wearing are reusable. So Izzy is now able to leave her room and, if she wished, would be ready to go and care for another resident. In this case, the session has finished, so Izzy is able to leave the resident's room and will go to the special area for the doffing of the rest of her PPE. To remove the eye protection, handle by the headband or the earpieces, but do not touch the front, and place on a clean wipeable surface. Keep your head up and close your eyes gently and lift away from the face while you do this. Gel your hands. If you're wearing glasses, now is the time to remove them and also place them on the wipeable surface. If you are wearing a face mask with ties, ensure that you fully untie the bottom strap first, maintaining tension, untie the top strap, and keeping your head up, close your eyes and gently lift away from the face and discard. Izzy is wearing the elasticated face mask, so therefore will gently look up, close her eyes, maintaining the tension, and lift gently away from the face and discard without touching. She would then wash her hands. To finish off, clean the eye protection or your glasses as well if you're wearing glasses with a green Clinell wipe or whatever type of cleaning solution your home uses. Pop a pair of gloves on again. And clean your glasses and allow them to dry. Also clean down your wipeable surface so that they're ready for the next time they need to be used. You are now ready to finish your shift and enjoy a well-deserved cup of tea.